Okay, it's 1 p.m. and I want to welcome everyone. I assume everyone can hear because we've been talking earlier and it seems the technology is working. I want to introduce myself. I'm Jessica Neuwirth, the Rita Hauser Director of the Human Rights Program at Hunter College, Roosevelt House Public Policy Institute. Before we start, I just want to say a word about the technology. As I said, I think everyone can see and hear the panel. And when we get to the discussion, there are two ways in which you can participate. If you want to come on the screen and be visible and ask your question, then raise your hand using the little hand at the top of your screen. If you want to type your question, then you can do that through the Q&A near the hand on that bar on the screen. And when we get to the discussion, Culkin will give you some more detailed directions. And I want to just give a huge thanks to Dan Culkin, Ramia Echevarria, Peter Sclafani, and Hector Perez for all of their help in pulling this together so quickly. And welcome to everyone who's joined. Already we have 100 people, more than 100 people. So we're very, very glad to have a chance to do a brown bag, no lunch though, sadly. But this is a really important discussion of the human rights and public policy issues that have come to the fore in this coronavirus pandemic. And as we've seen, various countries have addressed the crisis in different ways. Voluntary measures were very successful in South Korea, while Italy is facing a catastrophic situation. Just yesterday in India, Prime Minister Modi announced a 21-day lockdown of the entire country, more than 1 billion people. And here in the US, there are many views on the best way forward. All of these paths forward have very significant human rights and public policy impacts, and that's what we're going to discuss today. We have a great panel with us, and I will introduce them briefly. Jamil Dakwar from the ACLU, who's director of the Human Rights Program. Jamil is also teaching a course for Hunter College Human Rights Program this semester on national security and human rights. We have Phelim Kine from Physicians for Human Rights, where he is Deputy Director of Programs and Director of Research and Investigation. And Phelim Kine is also teaching a course this semester in the Human Rights Program on economic and social rights. And Dr. Ram Raju, a public health expert and Senior Vice President and Community Health Investment Officer at Northwell Health. And Dr. Raju is teaching a course in the Public Policy Program this semester on health policy. So tremendous thanks to all of our panelists for being with us today. And before we start, I also want to thank our Public Policy Program at Roosevelt House for co-hosting this online event with us, and invite Shama Venkateswar, Director of the Public Policy Program, to say a few words. Shama.
Jessica, thank you so much, and many thanks to all our staff for putting this together, and welcome to everybody. Special thanks to many faculty who are currently on, and a shout out to folks who have joined from Washington and London as well. Happy to see you all. This is a really important event in terms of bringing together discussions that we as a community must begin to have around questions of obviously privacy, surveillance questions as we build out a health infrastructure in the country, what happens to folks when you're trying to gain access to healthcare, but also troubling questions around the inequalities that have kind of broken open, not that they were never there, but actually made much more apparent based on race and class issues, and how the poor can actually have access, folks who are immigrants, those who are undocumented, how they can gain adequate care in these very unexpected times. So our panelists will be touching on a broad reach of issues that I think are absolutely on the table, and we as must begin to have discussions when we think about a way forward. So I'm just going to be very happy to actually turn to Daniel to talk to us a little bit about screen sharing. Or Jessica, are we all done with that?
I think we're going to do that a bit later
Okay.
when we get to the discussion, because we want to jump in. Each panelist is going to present for about 10 minutes, and then after the presentations, we'll have time for questions, comments, and discussion, and we'll have a little review of the technology at that point. So if it's okay, let's just jump in and start with Jamil Dakwar. Jamil, you have the
Perfect.
floor.
Thank you.
Thank you so much for organizing this online panel and under a very challenging time. So I want to be very appreciative of this effort. Let's think for a moment first about those in our communities who are unable to afford or have dignified access to safe shelter and housing, money for basic necessities, access to sanitizers and other hygiene products, and of course, those who are sick and struggling and those who are losing their loved ones because of this pandemic. I think that is something that is impacting all of us. And I would like to start by saying that something about the pandemic and then go into specifically on two issues that we'd like to address. If this pandemic is telling us anything, it is that we better get our act together as a human society, as a global community in terms of addressing the vast inequities that we have, and that we are all in this together, not just in a time of a global health crisis. This sense of reaching out to those who are most vulnerable and those who are most marginalized and historically discriminated should apply to everyone, not only in times like this, but at all times. And I think that if we can imagine and fight for a world where we realize the first words of the Universal Declaration of Human Rights, and I quote, "The inherent dignity and of the equal and inalienable rights of all members of the human family is the foundation of freedom, justice, and peace in the world," end quote. So in my few minutes, I just to address a few issues that come up as we, as community, as advocacy community, as activists, are working on these issues. First, emergency powers and what that means from a human rights perspective. Second, I would address issues of detention, both in criminal legal system as well as in immigration detention. And if I have a few couple minutes just to say something about surveillance. First, to start with emergency powers, more and more states, understandably, both at the national level, the state level and local level, are using emergency powers to cope with the challenges, to try to do as much as they can in order to provide the protection and to mobilize resources and means in order to respond to this pandemic. But we also need to be very, very careful, because often, if anything that we learn from history is that oftentimes these emergency powers outlast the immediate emergencies. And we have a history, not only in just in this country, but around the world, where certain communities, especially communities of color, have been targeted or being neglected, further marginalized in times of crisis. So we should remain vigilant and make sure that emergency powers are not being abused, are not being put in place and last forever. There should be time confined and limited to the real emergencies. That should be based on facts and should be based on information that is credible, based on medical health scientists and experts that would involve that in the process. And the human rights framework as a whole, we all know, is pretty flexible in giving governments flexibility in responding and handling emergency situations that threatens the life of the nation. But this has to be still be monitored. There should be an oversight. There should not be some sort of an emergency where certain government agencies are acting with no regard to basic human rights. And I think that we're seeing that some governments, unfortunately, around the world, maybe much less here in the United States for now, are taking advantage of the public health crisis in order to crack down on basic human rights, or overreact and deny basic protections for the most vulnerable, or those who are dissenting, those who are working as activists against particular government. We also have to be careful in this era in addressing issues of racism, the anti-Asian racism and stereotyping that we have seen from the president's comments all the way down to incidents of people who are being attacked children's being bullied in schools. These stereotyping and scapegoating in a time of emergency like this should end and should be addressed in a most careful way. And more importantly, we have to keep also access to credible information as much as possible. Both the UN expert on freedom of expression and the Inter-American Commission on Human Rights Special Rapporteur on Freedom of Expression issued a very important statement as to how people should deal with access to information, which is really important, and make sure that false information and other kinds of misleading information is not being used, particularly to discriminate against communities. I want to here mention specific statement that was issued, very unprecedented, by the chairpersons of the 10 UN treaty bodies. These are 10 treaty bodies, monitoring bodies that monitor compliance with the UN, with 10 international human rights treaties. And the experts from these 10 bodies said, states, and I quote, should adopt measures to protect the rights of life and health and to ensure access to health care to all who need it without discrimination. They also urge governments to take extra care of those particularly vulnerable to the effects of COVID-19, including older people, people with disabilities, minorities, indigenous peoples, refugee, asylum seekers, and migrants, people deprived of their liberty, homeless people, and those living in poverty. They also stress that women are at disproportionately high risk because in many societies, they are the main caregivers for sick family members. So with the safeguards that need to continue to be in place, that particularly making sure that even in time of emergency, even if there are certain rights that could be suspended and certain obligations can be derogated from under international human rights law, there are certain rights that could not be derogated. There are certain rights should not be suspended at all times. And for example, the right to non-discrimination is one of them. But quickly to go into the criminal legal system and people deprived of liberty, because this is an area where, particularly here in the United States, we are an outlier. We are a country that by far incarcerates more people than any other per capita than any other nation. There are, as some of you know, 2.2 million people are locked behind bars in the United States, and 4.5 million are on either probation or parole. Jails across the country are also incarcerating 462,000 people pre-trial who have not been even convicted of a crime, many of whom can't afford bail. So the US is in a situation where what we do is really critical, because it really sends a message, the right message, to not only people here in the United States, but to other countries that are also incarcerating more people. So in the midst of this global pandemic, what we need to do is to adopt a multi-pronged approach to the criminal legal system. This includes reducing the number of people interacting with the criminal legal system as a whole to avoid carceral sentences that put people at greater risk of contracting the virus, making a proactive and evidence-based plans in corrections facilities and prisons to prevent the spread of the virus and provide care for those who do contract it. And we also should demand the release of vulnerable populations and low-level offenders from prisons. Let's remember, incarceration levels in the United States are due to policy practice, not crime. If officials can release people to contain the pandemic, they can do it when we are not in the middle of public health crisis. And that's one of the things that we need to continue to think about. How do we come out of this pandemic stronger and able to provide the protections to all people? And detention is one example. There's a huge effort nationwide by many organizations, the national, state, and local level. ACLU is one of them. That are trying to push for the release of prisoners. For example, there's a call for the use of special powers or executive powers for example, compassionate release, commuting the sentences of those who were sentenced to 1-2 year in prisons, releasing vulnerable people, eliminating pretrial detention, etc. There's a lot that need to be done, and I think both in the federal and the state and local level, there need to be a more awareness to those people who are in detention, because density is an area where there's making people more vulnerable to be contracting the virus and not be able to defend themselves or protect themselves from contracting the virus because of the conditions of confinement. And quickly moving into the immigration detention, just like with the criminal legal system, there are many intersecting problems that we need to be addressed with immigration and COVID-19. The main goals are to downsize immigration detention with the priority of immediately releasing persons who, because of age or medical condition, would be at risk of serious injury or death, where they to contract the virus causing COVID-19. And we should also prevent people from entering these facilities by halting immigration raids. We are also should bear in mind that this is having this could have also serious consequences on asylum seekers and people who are trying to seek asylum during this time, and how this administration, the Trump administration, could use the current public health crisis as an excuse to push forward xenophobic border policies. Any approaches taken towards federal immigration detention of facilities should also apply to private immigration detention facilities. Unfortunately, we have several of those across the country. There are also concerns with conditions in facilities because neither ICE, which is the Immigration and Customs Enforcement, nor CBP, the Border Customs Protection, seem to have protocols or guidelines on how to reduce density and crowding to mitigate the risk of infections and provide extra resources to COVID-19 hygiene or provide immediate evidence-based treatment in the event of possible infection. So there's a lot of effort, as I mentioned, including lawsuits are being filed, and there's we see that hopefully that will bear some fruit and people will not be innocent. Unfortunately, more than 10 people already died in immigration detention in the United States, and there was a death in custody just reported in the last couple of days. We need to do everything we can in order to make sure that people are in detention are not exposed to the risks. And finally, on the question of surveillance, and I will stop there, is that we see many countries around the world are trying to put forward proposals and even passing laws, some of them emergency laws, in order to track people who contract the COVID-19 virus. This is a very concerning issue. We obviously, as ACLU and other organizations, we recognize the extraordinary times, that there are different balances may be warranted, and that the virus poses grave risks. So we should not write off tools that might help mitigate the problem, but at the same time, we should be skeptical about calls to embrace authoritarian style tracking as helpful measure in current emergency. And any users need to incorporate privacy protections if they are not going to be counterproductive. So we really to make sure that countries that have used location data in cooperation with those who are infected to help them retrack their movements and provide public health with list of places and times where infected people have been each day, so determine whether themselves can be exposed. I think there's a lot of risks with that, particularly when it comes to making sure that they are not relying on these companies, particularly those who already have violated the privacy rights, and they are trying to normalize the use of surveillance technologies in order to make it the new normal. I want to stop here because I know we have limited time, and I'm happy to answer any questions in the Q&A. Thank you.
Thank you very, very much for all those thoughts. Phelim Kyne from Physicians for Human Rights. You have to unmute your...
Done. Hi, can everyone hear me? Is that okay? Great. Thank you, everyone. I thank you first to Jessica and to Rami and to Hunter Roosevelt House for organizing this. This is incredibly timely and important, and this is also important, essential information for the community that we are serving in various capacities. So I really appreciate that. And I also want to say that I am very grateful that CUNY as a whole, particularly Hunter, is moving to address issues of inequity and inequality and access to resources in ensuring that our students are able to have the best educational academic experience possible given these extreme circumstances. And just the fact that we have this another pause coming up really reflects that the school is taking that seriously. So thank you. And I know that the students that I teach are grateful for that. It's difficult to come into a conversation after Jamil Dakwar, but I'm going to do my best. And I just want to speak really briefly, maybe from a more macro perspective. And I think one thing that this crisis exposes is the extent to which economic and social rights, and particularly the right to health, have been and are the orphan child of the international human rights movement and in terms of the priorities of governments. We see this particularly here in the United States, where we have an estimated 25 million people who don't have health insurance. And those who do have health insurance are stuck with a for-profit system that ties them to employment and saddles them with deductibles, copays that make it anything but accessible in many cases. In this country already, there are thousands of people who die because they can't access cancer treatment under their current employer-driven insurance program. So this is really exposing how health has been left behind. The other thing is that I think it's important to recognize that economic and social rights are so important, have been neglected, but they are interrelated and interdependent on civil and political rights. I think it's notable that the eruption of this virus began in China, in a country that prides itself on its quote unquote rights of livelihood and subsistence at the price of rights, civil and political rights, such as freedom of association, freedom of speech, etc. And the fact is that in freer societies in which there is freedom of media to report and expose issues like such as health crises, help to protect and bolster economic and social rights, such as the right to health. The right to health is meaningless if you don't know that there is a dangerous, contagious illness in your neighborhood because your government, for whatever reason, isn't willing to let you know that. The other issue that I want to raise is that the issue of inequality. I'm teaching a course here at Hunter this semester called Freedom from Want, which looks specifically at issues of wealth and income inequality. And this health crisis really exposes these yawning chasms in terms of people's access to what they need in order to be prepared for this crisis, in order to survive this crisis. I thought it was, in my class of 17 last night, there are 2 of my students have close relatives who are COVID-19 positive. I have another student who was demonstrating COVID-19 symptoms last week and went to a hospital and was turned away because there are no tests. There are no tests for her, but she pointed out that there were lots of tests for senior government officials, for the Brooklyn Nets, for Tom Hanks. So this is inequality in action. One thing that my students also mentioned, which I think is relevant to this conversation about inequality and rights and the response to this illness, is that certain senior political figures have actually benefited, apparently, profited from insider information about this illness, while not following through on their obligation to protect the rights and health of their own constituents. So these are issues that have been occurring in the United States, but are also relevant beyond those of the borders of the United States. This is a global health crisis, but it is also it's a human rights calamity. Like Jamil mentioned, this crisis is a clear and present danger to some of the most vulnerable populations in the world. Anyone who's in detention, whether it's immigration detention, in prison, Rikers Island, asylum seekers on the Mexico side of the US border, who are vulnerable, without resources, and who can't get into the United States to access their universal right of asylum because of the MPP Remain in Mexico policy. Up to 1 million Rohingya refugees in crowded refugee camps in Bangladesh. The Syrian exile diaspora of refugees in Turkey, in Greece. These are populations that are going to suffer the most in this. In our own neighborhoods, the homeless, people who are now unemployed, who don't have maybe now access to health insurance, who are facing cataclysmic financial crises related to paying rent, paying mortgages, etc. I realize that there have been some mitigation measures rolled out by the state and federal level, but it's still a very pressing issue. And the last thing I want to say is that this crisis really poses two potentially long-term serious threats to the concept of universal human rights. And I guess the provocation that I would make here is that the world is watching while the Chinese government is rolling out a extremely sophisticated and perhaps effective campaign of how the Chinese government, with a centralized authoritarian structure, is managing and handling this outbreak in a way which apparently liberal Western democracies can't. I can't tell you the number of messages I've seen from people I know on social media who are in awe of the fact that the Chinese government can build a 1,000-bed hospital in 3 days, and why can't we do this? And so this is a potential huge propaganda win for what they used to refer to as the Beijing Consensus. This idea that certain rights of civil and political rights are worth sacrificing for certain rights, economic and social rights, health, education, housing, etc. This is very dangerous. This is a long-term issue. And I think the second issue that closer to home is that we need to be, and Jamil mentioned this, there are, governments have a right to respond by restricting some rights. I emphasize that, in emergency situations, particularly ones relating to public health. But those situations are limited. And I think it's really important that we as human rights practitioners, advocates, researchers, are really put our government or government's feet to the fire in ensuring that any government policy decisions that are relating to the COVID-19 pandemic that impose restrictions on some rights should be subjected to very stringent conditions. They should be temporary. They should be proportionate to the threat to public health. They should have a clear legal basis. They should be subject to review, and they should be driven by science and public health expertise. And this is something, speaking kind of from the trenches of an international human rights organization that's dealing with these issues, this is something that has us flat out 24/7 in terms of managing, analyzing, assessing this deluge of government directives that are designed ostensibly to contain or mitigate the health issue, but can also be very, very malign in terms of longer term public acceptance of sacrificing some rights for a perceived greater good. I'll stop there, but thank you very much for the opportunity to speak to you.
Thanks very much for those really important reminders. Rule of law is always an important safeguard, even in times of crisis. Let me now turn to Dr. Ram Raju. Dr. Raju, you have the floor.
Okay, thank you very, very much. For a timely organization of this conference, and for the Roosevelt School of Public Policy and Hunter College, and to a co-panelist who has been extremely inspirational and also informative. I have spent my life looking at the health equity perspective, and the health equity and the social determinants of health, which are the non-clinical factors which affects the health outcomes in this country. So I'm going to come to you from that angle of seeing what it is. There is a miscommunication, a cliche saying that the pandemic has got no, it affects everybody. It affects the rich and the poor, white and black. It affects people who are literate, illiterate. But yes, it does affect them, but the outcomes are going to be very, very different. So as we speak about medically vulnerable communities, where we are people who are either over 60, the people who got chronic diseases, immunosuppressed, and also people who have got respiratory illnesses or high risk. The one unspoken factor in this entire discussion is there are socially vulnerable people who will also have a higher mortality compared to the people who are really medically illness. So I just want to show you, this is an article which came up. Sorry, just this one, the one, yeah. So in this is an article, right? We showed when we looked at the outcomes of what happened in China, coronavirus, the most vulnerable communities, according to Wuhan province, suffered the most. In fact, there have been reports saying that the people died of starvation and inability to get things because where the people resources were able to get this resource much more quickly and much more better. So though we think that the pandemic affects everybody, the people who are vulnerable, socially vulnerable, tend to have more difficulty and also more not enough ability to get the outcomes they want to get it done. It affects people in 4 different ways, right? So the first way it affects people is unequal access. Right? In fact, my co-panelists have kind of touched upon that. Access does not mean that just access should be looked upon, I always insisted, from the perspective of the patients. For example, if you say that there is everybody has an access to healthcare in this country because of universal healthcare or whatever it is, that does not mean that people have an ability to access that healthcare. There are other factors which are coming in there. The health literacy is a major portion of it, right? Transportation is a major portion of it. So there are issues where the people may not be able to have an unequal access to healthcare. This picture actually illustrates, if you are in a car, you afford a car, you are basically being taken care by a testing site where you are closeted within the car with the windows up and you're able to wait and to get it done. If you do not have that, you basically queue up in front of the hospital with no social distancing. Basically, these are the people who are sick and basically going to get the test done. They're all standing next to each other, getting the test done. This shows how the access is not the same for everybody. And my colleague talked about the access to care, access to testing. Absolutely correct. The people who have got power in the community, in the society, are the people who have got enormous amount of money or fame. They tend to get the test done much more quickly and without any hassle, whereas the people who really need that has got a difficulty in getting it done. And that picture says 1,000 words, how they queue up outside a public hospital system in New York City on a cold weather, wearing masks, shaking with fever, trying to get the test done. The second problem, the economic problem, right? It affects the most vulnerable people because the fact of the matter is most of them are daily workers who depend on daily salaries. Government saying, I'm going to send you $1,500 in a month's time or 2 weeks' time is not going to help them today. They're not able to buy their food. They're not able to buy their groceries. They're not able to do anything with that as a part of it. Second part, the economic problem is very compounded in these particular communities because they do not have the savings to fall back on, able to take care of them as they are doing what we call social distancing or clustering themselves in their homes. The second problem is social isolation. The social isolation in this group of people, medically, socially vulnerable people in this country, have got a higher percentage of mental health issues. This social isolation has got a lot of problems. First of all, it increases the depression in this group. And over a period of time, the suicidal tendencies and the number of suicides tend to go up when you cloister these patients within the social isolation group. So we need to be very, very careful in monitoring these things as we are going into that. So much of effort is being focusing on people who are medically vulnerable. But I am very sorry to say that we are not really focusing on the socially vulnerable people who are as much as risk as the socially vulnerable or medically vulnerable people. The third issue is the substance use and alcohol in this group. These people who are, it just came out alcohol rehab. They cannot really go to the AA meetings because during this time of social isolation, they always tend to revert back to alcoholism or the drug use. Or the people who are in a methadone clinic where they have to go and get a methadone every single day, right? That is being, grossly impeded because of the fact of what we are not able to do that as a part of it. That becomes a huge problem. The food insecurity is another big issue. These are the folks who are already living in the food insecure areas in this country. Right? These are not the people who are able to afford the supermarket. Most of these people live in the food deserts in this country, not able to get the real food and in the real time. Lack of money to buy the food, as well as the lack of food sources available to them, is actually impacting them much more negatively compared to anything else. The reason I'm pointing this out to this group, these problems are, as we are opening our wallets and going to fund $2.3 trillion into the system, we have to really focus some of those money in this socially vulnerable population, making sure that they get what we need to do that. Otherwise, the outcomes will be very, very catastrophic for this very vulnerable group of people. Let me stop here, and I'll be happy to answer any questions.
Thank you all.
Thank you so much, Dr. Raji. Sorry. Did you want to say something, Shama?
No, thank you. Jess, I was maybe thinking you were on
I got stuck on mute.
technological. So I just wanted to turn to Q&A perhaps.
Maybe first we just, I know a number of people have been sending, a few people have been sending chat notes, but there's only two ways that we're taking questions. You can come online and be visible and ask the question yourself. Please introduce yourself before you do that, or you can raise your hand. There's one question, if we need to do a tech briefing, we can do that, but I'm very conscious that Jamil Dakwar has to leave, and I think there was one question, Peter, that very much related to his comments. If you have that and want to maybe read that out for us, that would be great.
Sure. Can everybody hear me? So from Heather Strachan, we have a question about disability. Can someone speak to the impact of this crisis on the rights of people with disabilities? I'm seeing a lot of potential and indication of this currently happening in the triage protocols, in that the triage protocols are ableist and immediately discriminate against people with disabilities and certain underlying conditions in receiving life-saving treatment. We are triaged to the back of the line when resources are scarce. This is already happening in Italy, and a lawsuit was just filed against Alabama for its policy that certain individuals, intellectual and developmental disabilities, are not receiving ALS/ELS measures. So posing to the panel, can you speak to the impact of this pandemic on people with disabilities?
In the interest of time, let me just ask you to read the one other question. I think Jamil Dakwar might have some comments on that, so we can maybe just put those two questions to everyone.
Sure. So Bill Herbert asks, the increased use of location data during the pandemic highlights the lack of location privacy rights, particularly in the United States. What steps should be taken now to start developing post-pandemic public policies to protect against location surveillance by governments, technology companies, and employers?
Okay, maybe we'll just start with you, Jamil, and then go to the other panelists for any comments on these questions, and then we'll take some more questions.
Great, thank you. I think the first thing we should recognize is that data protection and privacy protection is obviously a long-standing concern, and I do agree with the participant who asked that we have serious gaps that we need to be addressing as part of legislation and make sure that the privacy protection laws are at par with the development of technologies, and there's serious effort that has been going on at the state level that I invite you to look at some of the ACLU work in this area in different states, where states are taking more lead in pushing for data and privacy protection, as well as at the national level in Congress. And I think this pandemic and this crisis, just like in any other area of rights protections, that will open opportunity to address those in a way that will make sure that there's the right balance, not just in a time of emergency, but in all times. That how do we make sure that we safeguard basic human rights, including right to privacy? And I think the location tracking that I mentioned as an example is of concern now, because it is something that many countries and even some tech companies here are talking to the White House about developing certain solutions. We're not seeing, we're not seeing, by the way, that this is the main concern. I think what we're seeing is that the main issue that that there's the urgent need is now, according to public health experts, is to ramp up testing capability, suppress transmission, through social distancing measures that were talked about. Already our underprepared hospitals and the medical institutions and system as a whole for a mass influx of patients who can't breathe. This is a real concern there. So we're not hearing that cry from public health professionals in particular, that they are asking for phone tracking that will be particularly the issue or the concern or the measure that will help them stem the outbreak from spreading. So we really need to take it based on the facts and based on this what we hear from the expert, particularly public health professionals. How do we really do that? And I think back to my point is that there's certainly ways that we should continue to push for further privacy protections, but don't think that we need to, for a moment, think that authoritarian-like measures are now all of a sudden will be the magic wand that will stem the outbreaks, particularly when these measures could also strike or affect the confidence of people and trust of some communities, particularly of coming out and report of their any medical needs or any symptoms that they have. So because of other reasons. So we have a long history of seeing that how all of a sudden security measures or other emergencies are used in order to kind of use it as a way to address the problem, but usually it's not a real issue. That the real issue is here public health crises that need to be addressed, rather than reaching to these vast and overbroad measures that will not help at this particular moment.
Thank you. Does either of the other panelists would like to comment on those questions?
I have a comment on the testing part, the disability and the testing part. We could actually do much, much better in the testing component, right? I have been in public hospital system for the last 20 years, and I have my own share of from Ebola to Zika to H1N1 avian flu. And the management could be much better. Again, there is nothing comparable to this. This is a much bigger problem. The fact of the matter, how creating a one center, two centers where everybody congregate may not be a good public health idea. So is not quite. It is not asking too much of the healthcare delivery systems to create 10 to 15 spots in their neighborhoods, in their catchment area to do the testing, so that we can create much less crowding as well as easy access to these tests as a part of it. So there is no point, instead of 10 doctors or 10 nurses and so who were taking the swabs in one place, we can send one to each and every places and able to do that in a much better way. Widespread availability of the testing and the access to testing is very important. If that is taken care of, then the people with the special abilities will be able to get to the test and get it done rather without too much of pain.
Please. Philip Kind, go ahead.
Yeah, that's a great question. I think that the sort of the uber point I would make with regards to surveillance is, if you look at American history, bad ideas, bad policies, abusive policies, discriminating policies breed in fear. This is a pandemic. Fear is also rampant, and so that's why we have to be as citizens, as activists, as human rights professionals. We need to be very, very concerned about whatever type of legislation, whether it's related to tech and to privacy concerns. Fear is what locked up hundreds of thousands of Japanese Americans for several years during World War II. Fear is what created rendition and Guantanamo Bay and abuses under the war on terror. So we're at this moment, we're at a historical moment when things can go really badly, really quickly. So complacency complacency can kill here, and it can have a long-term impact. I'm not a disabled, just to pivot quickly, disability rights, that's a great question in terms of the disabled. I'm not a disability rights expert, but what I would say is I am really concerned because any vulnerable, marginalized population in our society right now is even more so because of this. And unfortunately, right now in this country, the federal government isn't coming to help you. Okay, we're kind of on our own here, state by state, but also community by community. So that's why in a crisis like this, given the political context, it really calls on us to take care of our neighbors, to take care of the people around us, to take care of whoever we can as safely as possible. You know, I'm reading these horrific stories out of Spain in which they're discovering these nursing homes where elderly people, many of them demented with Alzheimer's, had been abandoned, and it's full of dead bodies and starving people. And this is something that we just can't allow to have happen here. But there's the threat when people are afraid. Thank you.
Thank you very much. We're now going to go to a couple of live questions from the attendees. We have one hand up from our own Professor Stephanie Ferrier. So I think Stephanie can come on the screen and question or comment, sorry. Stephanie Ferrier from the Human Rights Program.
Hi, thank you so much for this really excellent. Do I need to allow the video as well? Okay.
Sure, that would be great.
Yeah. Okay. Thanks, everybody. Now, I just wanted to highlight maybe one additional aspect of what I think really has to be included in every government's plan for addressing this crisis, and that are specific steps to protect people who are at risk of domestic violence. We've already heard of some abusers who are threatening partners with deliberate exposure, you know, if they don't obey and so on and so forth. We're being told to self-isolate, but that means being confined to a place of danger, a place of great danger. And the places that these people could maybe previously have turned to earlier aren't necessarily in a position to help now. That this is a critical human rights issue, and I wanted to urge anyone who's involved in policymaking to work with their governments to put in place plans to address this particular human rights issue as well. Thanks. Thank
you very much. That is a huge problem when shelter at home is becoming the new norm, and home is the most dangerous place for you. And many services are obstructed now. Does any of the panelists want to comment on that issue, as well as maybe some of the other gender-related aspects of this crisis?
I would just say, echo this important comment by Stephanie. I think that even in a time of emergency, particularly, as I said earlier, in a right to life, to protect people's security, and that would not be something that would be suspended just because we have that sort of serious pandemic. So there has to be a clear guidance and action taken in order to make sure that particularly women survivors of domestic violence, or those who are reporting domestic violence, are going to be getting the protection that they need, and they should not be punished for the situation that they're in by basically forcing them into the same location where they are. There's a due diligence that needs to be taken. We have clear guidance, particularly on gender aspects of preventing violence against women, that was issued by the Department of Justice during the Obama administration, that fortunately is still valid and should be applicable and helpful for these kind of situations. And I think, unfortunately, as others said, it may not be that easy to expect that this federal government to issue the right guidance for these particular situations, but I think acting on the state and local level, because these things are happening on the state and local level, and very local level, there need to be more guidance and pushing local law enforcement to be making sure that they are aware of what they need to do, and particularly when it comes to those who have also immigration status that is that could put them in a risk of being deported or reported or consequences. They need to be given the assurances that they will not be turned later on, or any data or information that's collected that would put them at risk in the future by sharing information about incidents of domestic violence. So these are really critical time for, and I think people need to think about all of these situations that are of people who could be in those risks, and then try to reach out to their advocacy community, try to reach out to their policymakers, the local ones, whether it's in the city level, the state level, their governors, and make sure that you can still do online activism, even if we can't protest outside, even if we can't be in crowded places. We can still ways that people and citizens, including this community in Hunter and on beyond, can take action in order to address these very issues that we're talking about.
Other comments from the panelists, or should we go on to the next question? We have among our participants, Carrie Bettinger-Lopez, who is an expert on this, worked previously in the Justice Department. I think one of the challenges is that we have to be creative about how to actually deal with these domestic, I mean, the normal remedies and the mechanisms are no longer functional when shelters are closing, and there are just so many health risks of doing the kinds of interventions that we're used to doing. So, so if we can just hear a little bit from Carrie Bettinger-Lopez, and then next on deck, Sandy Schramm from the Public Policy Program. Carrie, welcome.
Thank you, Jessica, and thanks so much for putting on this really important webinar. I actually just joined because I had to get off another meeting, but thanks to Stephanie for raising that very important issue. I just wanted to mention that our clinic at the University of Miami Law School Human Rights Clinic is working on this exact issue, and we're hoping to adapt that Department of Justice guidance that Jamil just mentioned, which is focusing on identifying and preventing gender bias in law enforcement response to gender-based violence. We're hoping to adapt it to kind of times of COVID, and as I was just mentioning in a chat with the panelists, the complexity here is a magnified version of the complexity that exists in thinking about criminal legal responses to domestic violence more generally, that our community struggles with. The question of criminalizing individuals and increasing incarceration rates as a result of domestic violence, while at the same time wanting to protect victims and be responsive to victims' needs for protection. And so this is, as I was just saying, a magnified version of that, because the COVID crisis is particularly heightened in places, in carceral spaces. And so if anybody has any ideas about that delicate balancing and the complexities there, I'd really welcome speaking with you offline. You can reach me, at the Miami Law website, and so we're hoping to develop guidance for police departments on specifically how they should be dealing with domestic violence in times of COVID.
Thank you so much, Carrie. Sandy Schramm, and then I know that we have Roseanne Flores, one of our faculty, if she can be on deck to come online, that would be great. Sandy here. Dan?
You should be joining right now.
Okay, great, perfect, thank you. Welcome. Go ahead, Professor Schramm.
Yes, no, I was saying thanks for doing this. I think it's a really important event for Roosevelt House to put on, and I think a lot of people are going to benefit from it. So in talk about delicate balances and tensions and federalism, the New York Times today just announced that they want the president to step forward and declare a national lockdown. While he can't enforce it, he can plead that the governors follow suit and that we, like India, just lock down the whole country, everyone shelter in place for as long as necessary. contrary to what the president has been saying the last couple of days about wanting to reopen the country on, of all days, Easter. So, I mean, in the face of that, I mean, they're calling for a total turnaround by the president to use the bully pulpit of the presidency to get the country to just totally lock down. And given the kinds of things you folks have been talking about so eloquently and incisively, I wondered how you felt about that.
Thoughts from our panelists?
Hi, thank you, Sandy. I'm just gonna. I think it's terrifying, obviously, that this is being pushed for, and that every press conference you see the president talk about like the 15 days, and we're at 9 days left or 6 days left, and we're going to open the place up. And so, you know, obviously that this is a clear and present danger to public health if that actually can be done. And I say if it can be done because it's not clear to me whether the president, whether the federal government can actually open up the country. So many of the restrictions that we've seen that have been implemented on a prudent, if tardy, public health justification are done by municipalities and states. So as somebody who lives in this country, I'm hoping that those municipalities and states, that their restrictions will remain in place and that this won't happen. But again, it's what you're talking about is sort of like the opposite of which is useful, but it's kind of the opposite of what we've been talking about in terms of restrictions. Like this is not, he wants to open it up rather than restrict things. So from a rights perspective, it's kind of thorny. But I'll defer to the lawyers on the line.
Yeah, I would say that I think that even the New York Times call, it may be a little even late for some parts of the country, to be honest. They're experts. If you're listening to their daily podcast, one of their experts have been writing on this and monitoring this since late January, have said yesterday that even if the only way that you can really ideally do that is by basically freezing the whole country in a social distancing situation. People are not going to be for 14 days in order to do that. And obviously that's something that's not possible to do. But even I think what needs to happen is that to make sure that people are getting access to credible information and getting clear guidance based on science and public health experts, rather than being motivated by what I think some politicians, starting with the president, are pushed or motivated by other factors or other reasons. And I think that's where we think that civil liberties and human rights you would find the right balance if you're able to really focus on the public health situation and getting that exact situation and tailor the need for whatever measures taken to that situation. It would not be as broad that you can go, but make it clear that this is, you're dealing with it as I said, without instituting overbroad something that will last beyond the particular situation. And I think in many ways, I think what we're seeing is more leadership coming from state and local government officials rather than from federal government. And it may be better that the country is being run that way, because a lot of the things that are impacting people are really at the state and local level. And we should make sure that they are getting the resources that they need, and they're taking the measures and being under oversight. There's no one should just rely and sit back and say I think that's part of what needs to happen in a time of emergency, that democratic accountability doesn't stop just because we are under very egregious situations.
Absolutely. Dr. Raju, please.
I just want to follow up on what Jamil said, something extremely important, which I believe is lacking. The first and foremost is just to have this conversation. I always believe that with one's ability or care to health, access to health and healthcare in this country is a human rights issue. It's a fundamental right. That's where I come from. That's what it kind of rhymes with me to talk about this. Access to healthcare is a major issue for me. Talking about Jamil, talked about the communication part, we are doing very poor job of communicating, because if the people I deal with, the socially vulnerable, have got a very low literacy level and they don't really speak English. We have a communication system from the president to the governor to the mayor, except a few words in Spanish at the end of a conference. None of these things are to be able to understand and follow those instructions. You got to have a college education and a English literacy proficiency. That is a major problem because a lot of people, the people whom we depended upon in the past to communicate the messages to these minority communities, their clergy, their local advocacy group, they're all shut down because they're not able to do any of those things. So I am concerned about the health literacy and not able to address these issues to the people's literacy level and language issues is as a major problem from what I see in my work with working with the vulnerable population.
Okay, let's take a couple of more written questions. Peter.
Hello again.
I'm just sorry to say that I have to log off because of other commitment. I have to join another important meeting, but thank you very much for organizing, and happy to be in touch with any of the participants related to any of the issues that came up. Thank you.
Thank you very much, Jamil.
Okay, we have a few questions from the chat from Dr. Roseanne Flores. As we think about access to healthcare, how are we thinking about the specific needs of children? As parents and families are under a great deal of toxic stress and not leaving their homes may lead to abuse and neglect of children due to living in close quarters. Are we working with psychologists and social workers to address these unique needs? And I have another question from an anonymous viewer. Hello, and thank you for the wonderful talk. I was wondering if you have any suggestions for what we as individuals or groups can do to help those who are socially vulnerable. I have particular interest in the refugee population in Greece, but I know there are vulnerable populations everywhere in the world who need help at this time. How do we advocate for our populations while being cognizant that people are in need everywhere?
Thank you for those questions. Thoughts, Dr. Raju?
I think the concepts I have kind of outlined shortly in my slide, the ability to support this vulnerable population economically, right? And the ability to give them food, and so that they are able to, they don't really have the money to buy the food, or they don't have the access to food. Supplying the food or giving it to them at various food pantries in the neighborhoods will be very helpful. Health literacy perspective, using the language and other things, be able to communicate with them in some way, not face to face apparently, but in different ways, it'll probably be much more different to do that. But most importantly, be kind to them and help them through this crisis, because they do not have any resources and they don't know, they don't understand how to use the resources. So we have to really figure out how do we engage them and make them a part of this recovery process, as opposed to they're just sitting there by themselves, not understanding, confused, frightened, and panicked, and really have no money to buy anything. And that is a very difficult place we put this group into. So I think we need to advocate for some amount of money which is being pumped into this crisis. The pandemic should definitely be used to address the specific needs of the socially vulnerable population.
Dylan, please.
Yeah, so I would just add in terms of like what we can do. And I think that one of the really pernicious effects of what we're all going through here, we're no longer watching something from a distance. We're in the middle of this, is a sense of helplessness. And for people like me who have, a roof over my head, I still have a job, I can telecommute, I have an access to food, etc. It's important to remember that a lot of people don't have that luxury. And I can just tell you what people in my neighborhood in Brooklyn are doing, and that is around on telephone poles and on postal boxes. Some people have put up signs saying, hey, if you need me to get you to go do a shopping run, to go to the drugstore, for whatever reason, if you're immune suppressed, if you're old, whatever, it's very analog, right? Because a lot of vulnerable populations aren't online. It's like rip off the piece of paper my phone number and call me and I'll do that. And I know that people are doing that, and that's really important. And this is a global crisis, and I think it's this idea of like feeling helpless, but I think in a sense right now, sort of starting at home and doing what you can for your own people and for your own community is really important. And and I mentioned elderly, and I think I just want to add one of the really disturbing aspects of how this is developing at the policy level, at the federal policy level, is there is this implicit but increasingly explicit ageist element to it. There's this idea that's being touted by pundits and by politicians that, it's this elderly population that's getting in the way of fixing this. Like, they're the ones who are vulnerable. If they can just get out of the way, we can get back to work, and the economy can rebound. And you even have people, politicians, talking about how grandparents should be willing to sacrifice their lives so that the rest of us can go back to enjoying the economy as it was. And these are, to us, these are crazy, extreme ideas. But so was at the time. So was incarcerating hundreds of thousands of Japanese. So was the idea 20 years ago of it's okay for the United States of America now torture people. So we need to be really, really careful and just remember that vulnerable people can be made more vulnerable by government narratives and government discrimination. Thank you.
Thanks very much. Okay, we have a hand up from the Center for Global Women's Leadership. If they want to come online or on screen, that would be great. And if you want us to see you, just turn on your video.
Sure.
Thank you.
My name is Melissa Upreti, and I'm Senior Director of Program and Global Advocacy at the Center for Women's Global Leadership. Thank you, first of all, for hosting this webinar. It's been very informative. I think I read the New York Times on March 23rd reported that Ohio and Texas have introduced measures that deem abortion services as the equivalent of elective medical services. What this means is that a lot of women and girls, or women and girls who need access to safe abortion, will not get timely access. Many of them will possibly run afoul of the law. They may be forced to resort to unsafe measures. But even from an international legal perspective, forcing a woman or a girl to continue an unwanted pregnancy to term does constitute gender-based violence. It is a violation of human rights. So how do we stop? And we know that these measures are politically motivated and anchored in ideology. So how do we stop opportunistic attacks on women's rights and attempts to roll back their rights by the creation of these unnecessary barriers? Abortion is deemed by the WHO as an essential service. So is contraception, which is another service that is needed to prevent unplanned and unwanted pregnancies. So I'm interested to know if any of the panelists have thoughts about how we deal with this, because if these measures are replicated within the United States or even elsewhere, it's going to create another public health crisis, which is likely to be drowned out in the larger context of this pandemic. Thank you.
Yeah, that's a great question and extremely disturbing. And here's how I would respond to that. I would respond to that by saying, this is just the beginning. I think that we need to be prepared. We need to understand that there are going to be multiple other attempts to essentially exploit the crisis that is unfolding as a way to push back established rights. I mean, here you're looking at women's reproductive rights. But I've also seen right now, there's all kinds of talk about how there appears to be a correlation between marijuana use in certain states and how COVID-19 is spreading. So we can see that the subtext is, here's a way to push back on efforts to end the war, the war on drugs. Also we see the CDC pushing essentially junk science interpretation of quarantine measures to deny the universal right of asylum. So I'm not a sexual and gender-based violence expert, but all I can say is this comes back to the point we were making earlier, is that we need to be absolutely vigilant, and we need to jump on this, and this requires concerted community action at a time when it's difficult, when we're all disparate, we're all in our basements and living rooms and whatever. But I think we just need to brace that there's going to be more. This is going to be opportunistic, and there are elements in society, powerful elements that see COVID-19 pandemic as an opportunity to push extremely non-progressive agendas. Thank you.
Dr. Raju, did you want to speak?
No, I kind of agree with that. I think this is really what is happening. But for the matter, I'm very sorry to see that politics on both sides are trying to use the crisis to push their own agendas in certain ways. It's not good. And that basically shows that to some extent that we don't have the leaders who are ready to lead us. They're basically in a situation where they're looking to gain one another guy just by doing these things. But these are all very disturbing trends. The trends, what the government is doing to, squash all the rights of the people, especially the reproductive rights of the women, is very concerning to me, and the domestic violence issues. But the fact of the matter is, we are not really, a lot of people, I was just watching somebody say this pandemic actually united us. It did not unite us, right? This is really groups of people trying to push their own agendas through this crisis to get what they want to get it done. And that is extremely, very upsetting for me to see.
Yeah.
Well, and I would just add, just to put in my 2 cents, these are all these decisions that are being made in our country and in other countries. They are decisions that are being made by our political leaders who have to be held accountable regardless of the circumstances. And even if we're all in our basement, we all have access to email, telephone lines. And I think our voices being heard is more important now than ever before. So thanks for that great question. We're going to go back to the Q&A now. Do you have a couple of questions or one question? Oh, sorry. Before we do that, Shama, did you want to say something?
Yeah, thank you, Dr. Raju. I actually want to pick up on that point. As a political scientist, I'm always very interested to understand, the levels of government which might be addressing or responding in a more progressive and intentional manner. And so I'm just wondering whether states that already have progressive agendas around food security or housing security or dealing with vulnerable populations, immigrants, certainly public investments in higher education, are those states in a better position? Are they better? Are they finding themselves at a point where they can actually mobilize support and certainly address, bring about more resources towards these issues? And are we going to literally see those states who have not had these issues on their agenda left behind at another level? So the differences and the inequalities are not just at the level of populations, but certainly within our own country at the level of governments and what they're able to mount as a response.
In a very polarized country at the present time we have, there are certain states which are not affected by it at all, or they're affected to a very small extent, and this is not in the centerpiece of the agenda. So they are looking at this entire crisis on the $3 trillion as my taxpayers' money going to some of the liberal states, which, as Mr. Klein talked about, Dr. Klein talked about is fact that it is really creating a lot of those progressive agenda items, and we are funding that. So this is a problem. There is not a civil discourse on these things, right, of doing that. We are mixing up the medical aspects of a pandemic with the political issues at hand and how to divide the money in a problem. This is the passing of this bill is only the beginning. Then the food fight will start. Who gets what, where, how, and who gets what the part of it. So this is the problem we are going to face. That shows the dysfunctionality of the country. And going back to what Jessica talked about is that, yes, we do have politicians doing that, but there are politicians, we have them in the past, who really looked at the things through the lens of the people and doing the good for the people. And then there are politicians who just looks at it from his own political, ideological lens and saying what has to be done. And so this actually highlighted the dysfunctionality we have in this country. The abrupt and clear division of the way we think about things and how we think about people who are disadvantaged in this country and how to help them. So this actually brought it to the focus more vividly compared to what we have done in the past. And that is very sorry to say that.
Yes. Okay, let's go to, I think we have a question online. Peter.
This question comes from one of our public policy students, Imani Senak. Especially with
Oh,
shelters
sorry.
closing.
Sorry to interrupt again. Phelim, did you want to add something to that?
Yeah, sorry.
Sorry, I missed that signal. Go ahead.
Yeah, Moot. I apologize. I need to jump off. I have another call I need to get onto. I just want to thank everyone at Hunter, at Roosevelt House for putting this on, Professors Newworth, Venka, and Raju. It's wonderful. And I just want to say, I just want to close by saying, in terms of what Professor Venka and Professor Raju just said, that this crisis is going to determine the next 20, 30 years in this country and globally. This is a really opportunistic moment for positive change, but also negative change. We've talked a lot about the threats of the negative change, but it can also be for positive change. And I think that's why it's really incumbent on people like us and for communities to get together to ensure that positive agendas and progressive agendas are have a chance in this environment. And I really hope this is such an important bringing together, convening, and I really hope that Hunter and Roosevelt House can continue to do this. Thank you very much. Solidarity. Stay safe, everybody. I got to go.
Thank you very, very much for being with us. Okay, one last question, Peter. Finally, sorry.
No problem. All right, so this question comes from Imani Senak, a new student in our public policy program. Especially with shelters closing, it may seem that those who do not have a stable living environment are being left behind. How can we ensure that they protect themselves and are not being left behind? Are any measures being taken to address the issue for people who are homeless and the staff providing services to them?
This
Raju.
This is really a very unique problem to New York City, and having worked in the city government for many years, it is a big problem. So how do you manage the overflowing shelter system and practice all the things we are supposed to practice, and with the social distancing and making sure all those things is becoming a major issue. And that got exacerbated because a large portion, I think the last number were like 70,000 to 100,000 school children live in the shelters. And when they close the schools, they have to go back to shelter. They don't have home to go to as a part of it. So again, we are going back to the original concept that the people who are already socially vulnerable, their vulnerability got increased 100-fold, 1,000-fold because of this particular policy, some of the policies which are really forcing us to create more inequity in this population. And that's a very good question. This is something which I don't think we have not grappled this even in peace times. Now we are going to really find it very difficult to grapple this in these tough times where you really wanted them not congregate, social distancing, how to manage that the cross-contamination, all those things are going to be very, very difficult to do that. So I don't think we have a solution to it yet. They're trying to do the best they can at the various levels, but simply we all know that there is not enough housing available for all the New Yorkers. And the fact of the matter is, New York being the city right to shelter, right? Anybody can walk in and ask for a shelter. That's a good thing, but then that puts a lot of pressure on the government to get it done.
Thank you very much. Well, I think we're coming to the end of our time. Shama, do you want to make some concluding remarks?
Thank you all to the panelists and to the folks who unfortunately couldn't stay, Jamil and Phelim. What we heard today was definitely the need for a more intentional focus on multiple vulnerabilities that we're all facing. It's the health pandemic has just surfaced a variety of vulnerabilities, not to mention questions of privacy, surveillance. We are not even, touched on the notion of this very platform that we're using, Zoom, and the questions around privacy and how data is being shared and misused if there might be. So understanding those implications as well is important at this time. And I think at the end of the day, domestic policy response here is also deeply connected to our foreign policy. I know there were a bunch of questions that came in that looked at, what is US's platform in the world today, understanding, as we're retreating from other ways to show leadership in across the world, this is also a place where the US could play a role, but is not necessarily showing its leadership. So thank you to the panelists very much for drawing on a variety of responses. And I thank you to all the folks on the line who have sent in questions. And unfortunately, we have not been able to address. I hope, and this is a conversation that we at Roosevelt House need to have, to kind of continue to update you on the responses in the US and abroad, and we can continue to convene this forum. It was easy enough to do. So maybe with new speakers with specialties in other areas that we have talked about, we can continue to bring this to you, and I hope we can do that. So over to you, to Jessica, to close and adjourn.
Thank you very much, Shama, and thanks to the Public Policy Program again for helping us convene this, and all of our incredible team of Daniel, Peter, Hector, and Rami. I think we had a great discussion, but obviously there are a lot more questions than answers. We're in a crisis that is really unprecedented in scale, at least in our lifetimes, as far as I see it. And, we talk about shelter at home, but then what about homeless people who don't have a home? What about people, women for whom the home is the most violent place? And how do we balance these much cherished civil liberties with the health needs that are suddenly so dramatic, and how do we make sure that extreme measures that are taken are temporary and subject to the rule of law, so that we don't end up really losing ground in terms of human rights in an irretrievable way. So these are all really important questions that we've touched on today, and I am sorry, as Shama said, that we weren't able to get to everyone's questions and comments. This is a very new platform for us. It's an experiment, and I think what it does show us is that even if we're all sitting in a computer at our home, we can come together, and we actually had probably 10 times more people than we usually have at a brown bag lunch. So, so that creates some opportunity for us to have discussions and try to use the technology, however imperfect it is. And I want to just add my thanks to the panelists and to all of you for your patience and for being online with us. And hopefully we will reconvene and keep you posted on further discussions, and welcome any feedback that any of you have. So stay safe, everyone, and thanks again for joining us.
Thank you very much. Thank you.